this lesson entitled Caring for Veterans, Factors Influencing Reintegration. In this module, we'll focus on three factors for veterans: mental health, employment, and physical injury. Although we take care of a lot of veterans in the care center, this module focuses mainly on the new veteran that is just coming back from war. It's always possible that we could take care of one of them. These are the learning objectives for this module. The learner should be able to articulate the effects of war on mental health and the return home, discuss issues involving veterans' transition to the workforce, and discuss how physical injury affects a soldier's reintegration into society. Returning from war. Families dream of the day when their loved ones get to come home from military service. The picture that you see on the right shows just the sheer emotion that soldiers feel after being away from their loved ones for so long. The sad reality is that the honeymoon phase soon ends, and soldiers are hit with that reality when they come back to civilian life. According to the National Academy of Sciences, there are over 18 million veterans, and about half of them utilize the VA. Sadly, over 44% returning from war admit that they do have a difficult time readjusting, and most issues of readjusting are related to health. Fortunately, resources are available. However, access to these resources can vary widely across the United States, especially if you're using the VA. First factor we'll look at is mental health. Research on various wars really brings to light the mental health issues that can emerge among veterans. Common phrases we hear are "war is hell" or "beyond the understanding of most people" is frequently heard. The truth is, soldiers endure a human experience that's unique to only a few people. Most civilians would be unable to describe a time when their friend's limbs were blown off or a comrade was taken as prisoner. Being at war and living in a constant state of fear or worry about tomorrow would undoubtedly change a person, especially the longer that the stress continues. Many do not have access to support, and they end up turning to alcohol, drugs, or even self-harm. With women joining active combat roles, as of 2013, this is relatively new, we may gain additional knowledge into their individual needs and struggles. Thankfully, the government has come up with over 900 suicide prevention programs that are currently in the works. Why is it so difficult for veterans to get help? Well, it's suggested that soldiers who are married have a less difficult time dealing with traumatic events. Nevertheless, soldiers feel a sense of social isolation upon return because they have trouble sharing their experiences with others. How can one get help if the listener doesn't understand and can't relate? When a soldier feels isolated, they lose their sense of belonging. Further, if a soldier feels a lack of support, that person will start to feel like a burden on others, thus perpetuating that cycle of mental illness. When people are dealing with a mental health illness, they may experience a subset of symptoms that are vague and can mean anything. For example, GI illnesses, migraines, fatigue are just some of the many. These folks often go to the doctor and they're treated for symptomatic management, but without finding the root cause, the cycle just continues. Consider military culture on the concept of getting help. Soldiers are trained to fight and defend. It isn't part of the culture to display weakness. Finally, long waits at the VA have been cited as a factor to receiving help. Let's talk a little bit about PTSD, post-traumatic stress disorder. PTSD and veterans are often two words that go hand in hand. Veterans experience traumatic events, like I said before, watching friends die, narrowly escaping death themselves, or maybe just feeling guilt from not being able to save their comrades from injury or death. Either way, the stress may manifest itself as PTSD immediately after the event or months or years later. Mayo Clinic notes that people go through traumatic events in life, and being resilient beings like we are, we tend to work past these issues over time. However, when traumatic events begin to interfere with daily life over months or even years, a diagnosis of PTSD may be appropriate. Avoidance may be a symptom nurses look for when assessing these patients. So for example, does the veteran seem emotionally numb or disengaged from activities that they once enjoyed? Assess the veteran's ability to get a good night's sleep. Does the veteran have issues maintaining relationships, or has this person turned to alcohol to cope? Treatment usually involves a combination of psychotherapy and medication. Remember, soldiers are trained to be war hardened. They may not want to show emotion. When assessing the veteran, be sure to emphasize the importance of getting help and expressing emotion in order to achieve recovery. Sexual trauma. Sadly, cases of sexual trauma may actually be increasing among members of the veteran population, especially women. Sexual trauma can be classified as anything from rape, sexual advances, or even just lewd jokes or remarks. According to the Disabled Veterans, 1 in 4 women and 1 in 10 men on active duty experience sexual trauma during their service. This population is already vulnerable to depression, anxiety, PTSD, and other mental health issues. So it's awful to think that something completely preventable, such as sexual trauma, still occurs in this population. Some researchers do believe that this sexual trauma is decreasing, but reports show rape has increased from 3,374 cases in 2012 to 5,061 cases in 2013. It's statistics like these that show how far the military has yet to go to combat the problem. The DAV does promote good counseling through the VA for those that have experienced the trauma. The military has also created a sexual assault prevention and response program to train all military members to identify those that need assistance. And all the problems that we face can lead to alcohol use and misuse. Alcohol use is common among service members. Many drink for social pleasure, and if done in moderation, can help bring people closer together. Some bars even offer discounted beverages to service members as a way to say thank you. What many may not realize is that alcohol use has gotten out of hand for some veterans. Active duty personnel drink heavier than most. The stress of being on active duty can wear on these veterans, and they'll turn to alcohol to make themselves feel better. 1 in 3 active duty personnel can be classified right now as a binge drinker, and 5% are heavy drinkers. Alcohol use and PTSD are often diagnosed together. I did a brief internet search to see what kind of resources were available to veterans, particularly within the VA. Treatment centers are available as well, and treatment is out there. It exists. Alcohol abuse and mental health disorders go hand in hand. It's estimated that 50% of Iraq and Afghanistan war veterans have some sort of mental health diagnosis. A statistic like that should make nurses aware of the need to care plan creative and effective interventions to address the unique needs of this group. What are some nursing considerations when caring for the veteran with a mental health diagnosis? Well, nurses need to understand the uniqueness that veterans bring to the table. They have human experiences that the rest of us thankfully may not have to experience. The love for their country is strong, and the culture that they were a part of may prevent them from opening up about their experiences. Many feel that their care team may not understand the issues, and the truth is many of us just cannot. If a nurse needs assistance addressing psychological needs for this patient population, find a coworker that has had military experience and can relate. Encourage the patient to seek help when appropriate. Anxiety, depression, PTSD, alcohol use, they can be debilitating and they can destroy one's quality of life. Hope is out there and resources do run abundant as well. The second factor that we're going to talk about is employment. So the U.S. military does an excellent job providing servicemen and women with the skills that they need to function within their roles. But reports show that veterans struggle with translating this knowledge into skills after their country service ends. So if veterans struggle with reintegration, they may also struggle with gaining and holding employment. To further complicate matters, about 4.5% of new veterans 25 years or younger hold a degree. So upon return from active duty, many people feel like they're starting their careers over again. It's really a wake-up call that most people just aren't prepared for. That takes us to education. Many servicemen and women choose to make military careers for themselves as opposed to serving for a period of time and then discharging. Many young men and women take interest in joining the military as a form of continuing education that's paid for under the GI Bill. College is not cheap. I think I racked up a good $70,000 in college debt after I went. And the military would have been an option, but for those that are 25 years or younger, like I said, only 4.5% hold bachelor's degrees. 61% report needing additional education assistance, and 65% report needing help to find employment after discharge. These numbers are far higher than those who report coming home with mental health issues. I mean, education and employment is the #1 biggest issue. Research also points out that service members have unrealistic expectations for employment upon return. This could also mean unrealistic expectations for salary. It's just not as high as they think it'll be. Well, if you don't go to college, if you don't have an education, if you don't have a job, there's a high chance that you could become homeless. Owning a home in of itself costs a lot these days, and renting can be just as painful. We all know that. Those unable to find employment or retain employment due to physical or mental health limitations are more apt to be homeless. Statistics show that veterans aged 55 to 64 have a lower net worth than their non-veteran counterparts. And I don't know why. It is weird to think because these people, they don't necessarily have college debt if they utilize the GI Bill. But think about this. Once homeless, it creates a cycle. It becomes difficult to get a job. Throughout my entire life, I used to see homeless people panhandling across the street from McDonald's in Rochester. The one closest is in Broda on 52. And this may lead to the assumption that the homeless or the unemployed are just lazy, even though jobs are abundant. However, this assumption in a lot of cases is dead wrong. Homeless people struggle to find work if they don't have a mailing address, if they don't have a place to charge their cell phone, which means they can't answer a call. Who's going to want to try to reach out to someone that they can't get a hold of? Homeless people have an inability to stay clean, and they have gaps in employment history. And unfortunately, many have criminal records simply for sleeping in the wrong place at night. Can you believe that? I'm homeless, I need to sleep somewhere, and now I'm charged with a misdemeanor. Great. So consider veterans who are disabled due to a physical or mental ailment. Finding and retaining work for them is just as difficult and further perpetuates that cycle of homelessness. Consider the cost of living these days. Many who are homeless are also employed, but they can't pay the rent. It's just too expensive. I once considered a job in Eagle, Colorado, and you know how much the starting wage, or I'm sorry, the starting home price was over there? It was about 1.6 million for all of those people that were looking to live out there. So that $110,000 salary wouldn't have meant jack. Nursing considerations for homeless veterans. All right, homeless patients frequent the emergency department, and they're usually non-compliant with treatment, which leads to nurse burnout. Nurses providing care need to direct their focus on ensuring basic needs are being met. So, what does the patient's teeth look like? What's the condition of their feet, their skin? Are there needle marks? Are there any signs of drug use? The prevalence of preventable diseases such as STDs, tuberculosis, hepatitis, and scabies, those kinds of things run rampant in this population. I recently did my tuberculosis assessment for the care center. And you know how many cases of tuberculosis we had last year? 0. That's a pretty good number that unfortunately can't be said for the Twin Cities. So to provide good care, the nurse also needs to understand where the patient lives and how they operate. Do they live under a bridge? Do they live in a tent? Do they live in the woods? Do they live in this conglomerate tent community that might exist in, say, Minneapolis? All of these factors contribute to that higher prevalence of communicable diseases. Remember that the homeless often live day to day, and they fail to look long term due to their needs to need to survive just through today. So when you approach these patients, ask open-ended questions like, what would make your day better today? Not just in the long run, okay, because they don't think long term. Coordination of care is essential, as there are many services out there to assist this population. There are agencies that provide emergency shelter, food, medical care. Refer to religious groups, churches, soup kitchens for food, and then consider county resources to help with housing referrals and job placements. And of course, our wonderful social workers are perfect for that job. Our third factor that we're going to talk about is the physical alterations. So although mental health is a big concern amongst our veterans, we can't forget those that come home with physical disabilities. Many who have served come back with loss of limbs, severe burns that disfigure their faces, maybe loss of vision, brain injuries, many more. These alterations force the veteran to adapt in new ways that he or she did not expect to coming home. Those with physical alterations will undoubtedly have mental health needs as well to make adaptation to the disability easier to deal with. Other injuries to consider include those to internal organs and soft tissues. Those might be noticeable to the veteran, but might not be noticeable to us, but they will affect the veteran's everyday ability to function. Loss of limbs. Okay, terrorists have a lot of ways of causing death and destruction. Whether it's through suicide bombings, landmines, IEDs, these groups have been relentless and have imposed permanent disability to our servicemen and women. All of them can just go to hell. Many years ago, these soldiers would not live through these injuries. Over the years, we've developed blood clot dressings, improved surgical techniques, given blood transfusions to help improve outcomes. Clinics these days will see more patients coming to the clinic with these life-altering disabilities because of our advances in life-saving technology. The nurse must consider how the patients have adapted and how they're coping through these changes. Unfortunately, many people that can't cope will turn to drugs and alcohol to deal with the depression. Grieving physical alterations. Terrorists have many ways of causing death and destruction, whether it's through, I'm sorry, did I read that already? So grieving physical alterations. There are many things that may occur as a result of this grief. You have to be able to express the grief. Besides encouraging the patient to participate in therapy, there needs to be an emotional process that takes place to help the patient accept the changes that occurred. When someone's entire way of life has been altered due to injury, they have to learn to adapt, and a lot of times the entire family has to be involved. Veterans may not like to express emotion or grief, but when feelings are pent up and they're not expressed, they're difficult to let go. So consider the words of Bob Kaufman. He's the founder of Critical Thinking for Success. He states, I would advise them to express their grief as much as they can. When we reasonably express our feelings, grief included, those feelings complete themselves and we don't have to keep feeling them. The difference between a feeling and an emotion is that a feeling is experienced in the body and an emotion is a feeling expressed. When we don't express our feelings, they just stay in our body because feelings don't know time. I thought that was very powerful. So please listen to that again and remember it. Next, we hit traumatic brain injury. So a traumatic brain injury is caused by an induced external force. So blast injuries described in slides prior may be a cause of traumatic brain injury. Those affected may suffer from a vast array of neurological symptoms like ringing in the ears, confusion, headaches, trouble sleeping, pain, dizziness, the list goes on and on. Although a traumatic brain injury may not be noticeable on the outside right away, an injury to the brain may be noticeable when engaging in a conversation and completing that nursing assessment. So look for any gaps in cognition. Nursing considerations for the veteran with physical alterations. So besides encouraging the patient to participate in physical therapy, which is very important, you have to make sure that grief is expressed, as I said in the slide earlier. So I'm repeating this because I feel that's very important to make sure people have the opportunity to express grief and get the help that they need so it doesn't lead to alcohol use, drug abuse, or even suicide. Which takes me to suicide. Nurses must understand that a soldier's experience on the battlefield can lead to anxiety and depression. An inability to deal with those thoughts and feelings could lead to suicide. The veteran population is 21% more likely to die by suicide than the general population. The leading cause of death among veterans is suicide. When a veteran presents with symptoms of depression, the nurse should assess for the patient's desire to harm his or herself or to see if there's a plan in place to do so. There are two factors, though, that protect against suicide, and that is marriage and religion. So as a nurse, you might want to bring these two things up. Upon return from deployment, family will need to be highly involved to help with a successful transition. Other causes of suicide related to depression include chronic pain from injury or relationship problems. Servicemen and women struggle with a lot of fractured relationships and marriages just due to the time that they spend overseas on deployment. So consider also if the patient has firearms at home. Soldiers are trained to use lethal force effectively and on the first try. Okay, so their ability to end their lives is stronger than a lot of people may realize. I just have 3 slides with 3 quick topics I just want to share because I feel that they're noteworthy. The first one is the VA, the Veterans Health Administration. I think you know that the VA has been plagued with bad reviews in recent years. The war in Iraq and Afghanistan has increased the number of veterans within the population. Frequently cited issues include long wait times, and that's led to negative patient outcomes. Other issues include just general mismanagement, inability to retain senior leadership, falsified patient records, preventable deaths. Sounds like a nightmare, right? Many veterans would gladly utilize the VA, but sometimes they just live too far away. So efforts are being made to integrate virtual options and transportation. Without these options, patients may wait months or even years to obtain appointments, as some have. The most significant issue that has been noted in recent years is a delay in care, which results in poor outcomes. Despite a law that was passed in 1996, which requires a patient to be seen within 30 days of a consult, this is not happening. Some of these wait times are a lot longer. There was a story of one person who was supposed to see a doctor in January 2006, and the front desk receptionist put it in as October 31st. And then the patient wasn't seen until December. I can't believe that happened, and nothing was done to rectify that situation. The reason I bring it up is because, this is beyond a nurse's control, but I feel that issues are worth noting if it involves patient satisfaction. Nurses want to provide exceptional care. Long wait times will certainly decrease patient satisfaction and lead to more grievances. Finally, I just want to share some special considerations for women veterans. Nurses should be aware of the ever-changing roles of women in combat and that the effects of those changes have not been completely seen yet. So for instance, it was just in 2013 that women were granted permission to progress every rank that a man could, including combat roles. Previously, their participation was limited to telephone operators, nurses, mechanics, cooks. At the time, women's participation in the military had to be limited to 2% of the total enrolled population. Today, we're seeing women hold 15% of positions in the military. Women still hold the greatest risk for discrimination and sexual harassment. Military service is primarily something men enlist in, so women don't always feel equal to men in a male-dominated industry. Just in summary, 4 points to take home. Servicemen and women are at high risk for poor mental health, high unemployment, physical alterations. The nurse may not understand a soldier's unique experiences. It may be difficult for soldiers to accept help given their military culture, and then assess for risk factors related to suicide and provide resources through social work in your county relations. And of course, we can't go through a presentation without listing the resources that I used to draw my conclusions. This is page 1. This is page 2. And don't forget page 3. Thanks for listening, everyone. I hope you learned something. Bye.